The effects of COVID-19 on musculoskeletal injury in children. This paper looks at diagnostic imaging using this for children with articular and muscular symptoms due to COVID. Now, musculoskeletal symptoms have been widely reported in the acute phase as well as part of the long COVID symptoms. These symptoms include the muscles, the joints, arthritis, myositis, and has been shown to happen in both adults and children. Generally, acute myositis in children and even like in adults is kind of rare, so it's not typically part of the diagnostic workflow in radiology for imaging for this. The great thing is that it's easily detectable through MRI, magnetic resonance imaging. As a reminder, myositis is the inflammation and degeneration of muscle tissues. So this muscle weakness is typically targeted to the thighs and gluteal muscles, with a few cases also being in the eyes. The really nice thing is that if it's detected early, such as in this case with orbital myositis, so eye inflammation and degeneration of the muscles there, and a 12-year-old boy where enlargement of the orbital muscles was diagnosed with CT, then the patient was able to be successfully treated with steroids and fully recovered within a week. Now, outside of this muscle inflammation, we also have children getting arthritis, usually within 4 to 6 weeks after an infection, where two cases, one with an 8-year-old boy and a 6-year-old girl, involved the hip joint, both showing joint effusion. This is where you have a fluid buildup around the femoral head, and the femoral head is the ball joint within your femur. But once this was diagnosed, it was successfully treated for the arthritis with nonsteroidal anti-inflammatory drugs, and they recovered within a short time without long-term consequences. Now, this is an image looking from the head down. That's the myositis of the paravertebral muscle. And then for the joint effusion, this is the femoral head in the hip, and see that that's the fluid surrounding it. And then this is a contrast imaging, so there you can see the fluid easier. However, these things need to be caught early. For example, we have an 11-year-old girl that developed severe muscle soreness and arthritis in the ankles, knees, elbows, and wrists after 3 days of onset fever. She was then discharged from the hospital without anything happening, so no scans. She didn't get the steroids she needed. And then 6 weeks later, she was still having persistent arthritis. So they decided to treat her with steroids, and she showed clinical improvement. However, 5 months after the infection, there was synovial thickening seen at the ultrasound, and she was experiencing morning stiffness with very high blood settling rates, which suggests that she is experiencing chronic arthritis. And this is, again, an 11-year-old girl now with chronic arthritis from COVID. So in conclusion, children may have musculoskeletal symptoms. So if the children are experiencing musculoskeletal symptoms, definitely get imaging so that you can detect these and they can get the appropriate treatment. Otherwise, they could face long-term consequences.